I see lots of newborns on a weekly basis, and the vast majority of them who come to see me are for breastfeeding issues and the child having tongue ties. So a tongue tie is basically a filament, a membrane under the tongue, which hasn't disappeared before the child is born, and that limits the movement of the tongue. And when the tongue cannot be protruded, they have issues with breastfeeding. One of the symptoms is that they are not happy after feeds, and maternal pain, basically where they bite on the nipple, and mothers can experience pain.
So this must be a real cause of stress for these new mothers who are probably thinking that the child isn't taking to them, or I mean, it must be obviously
That's
very
right.
stressful
So
situation.
one, it's painful and stressful. The child is constantly wanting to feed. He's not happy, and the mother is not happy because of pain. And basically, the child wants to feed all the time. So one of the things you need to look out for is just look under the tongue. When the child is lifting the tongue up, see whether there's any membrane underneath. And if you're experiencing pain, one of the key features of tongue tie causing breastfeeding problem is maternal pain. And also the child being unhappy, wanting to stay on the breast for a long time, and also not satisfied after the feeds.
So Dr. Nada, if a child is facing a situation with tongue tie, what's the treatment?
So treatment is, once we establish that the tongue tie is causing problems, then it's a quick snip for a newborn baby. So basically the tongue tie in a baby is a very thin membrane with very tiny blood vessels. So they can be divided very easily without too much of an issue. So once that's divided, the baby then can feed immediately after the tongue tie is done, tongue tie division is done. And once the tongue tie division is done, baby goes on the breast again to be fed, and you would probably find that almost 90% of them improve immediately. That you can feel a complete difference in the way the baby feeds.
So the typical from when the treatment is actually done or the procedure is done to recovery, what's the typical duration?
So it's the recovery is almost instantaneous.
Oh wow, okay.
So it's a quick cut. The baby will experience a little bit of pain, although we give them some pain relief. The pain is minimal, and once that's done, baby will recover almost instantaneously. The tongue tie release is done in the clinic. We don't require any anesthesia. However, if the tongue tie, the child with tongue tie requires a tongue tie release at a later age, about 2 or 3 years of age, when they have speech issues, then the tongue tie needs to be done under gel anesthetic. So the child have to be admitted, go to the anesthesia and operating theatre to have it formally divided, because the tongue tie is much thicker at that age, and also the child is more
aware
and vigorous compared to a newborn baby. And at the same time, when we do the tongue tie release at an older age, we need to seal the blood vessels and also stitch the raw surface together.
Right, but that's also relatively a quick recovery process.
It's a quick process. It's a quick process, even if it's done at a later age. It's a quick process. So they can go home same day. They can eat and drink almost instantaneously.
That's good. Thank you, Doc.